Smarties, today we welcome back Karen Wilson, a neuropsychologist who has a private practice in Los Angeles. She is also the founder of Child Nexus, a platform that connects vetted professionals with parents and parents with vetted professionals. She shares about why individuals seek out assessment and the differences between all the different types of assessments. Also, be sure to listen to our Patreon where we deep dive into what constitutes our busy seasons, both as educational therapists and neuropsychologists, and also what parents need to know about scheduling assessments. And we talk about so much more. You can listen to that episode on our Patreon, which is www.patreon.com/LearnSmarterPodcast. And for $5 a month, you support the work that we do here at Learn Smarter Podcast. And we thank you with these extended conversations with all the amazing professionals that we are so fortunate to have on the podcast. Let's dig in.
You want to learn faster, but sometimes working harder is just not the answer. You have to learn smarter. The Educational Therapy Podcast.
Hi, Smarties. Welcome to episode 325 of Learn Smarter, the Educational Therapy Podcast. I'm Stephanie Pitts.
And I'm Rachel Kapp.
And today we are thrilled to have back
Finally
with us Karen Wilson. Karen was a guest on episode 61, and she has done all of these amazing things since we last spoke to her on the podcast. And so we are thrilled to have her come and talk a little bit more about clinical psych reports and neuropsych reports and tell us all the things that she's been doing. So welcome, Karen.
Hi, thank you so much for having me.
We're so excited you're back. And when Steph and I were talking about this episode, we're like, Karen's the person. Let's just ask her. So we're so grateful always when you say yes, and we love getting to partner with you. So it's been
so long.
I mean, years.
So long.
Years. I can't believe years have gone by. So why don't you sort of reintroduce yourself to our audience and then update us? Because I don't even think you had launched your podcast when we last podcasted.
No, you didn't.
I don't think so. I mean, so I'm a pediatric neuropsychologist. I've been doing, assessments, evaluations of kids and teens for, I can't believe I'm saying this, but over 20 years. And I love the work that I do. And since we spoke last on the podcast, at least, developed a platform that helps connect parents whose kids are struggling with learning, processing, mental health challenges, with resources, including connecting them with amazing professionals like yourselves who help kids thrive, succeed, access curriculum, and reach their full potential.
And
oh, did I not mention the podcast? I also, and actually this happened during COVID, launched the Diverse Thinking, Different Learning podcast, which really serves as another way to connect parents with resources, information, help them better understand their child's learning profile and connect them with resources in the community and beyond to, again, help them better understand their child and access supports that will be helpful.
And I've been on your podcast a couple of times. Steph, have you been on?
It's been a couple times, right?
I think I've only been on it once.
Oh no, we got to fix that.
I don't remember, but I think.
And we'll be sure to link all this information of how to connect with Karen and how to connect with Child Nexus, which both Steph and I are a part of, and also her podcast as well. And if you scroll down in the show notes of other episodes mentioned, which is in every episode, by the way, that we release, we have an other episodes mentioned section, just in case you haven't scrolled down. And we've linked the previous episode with Karen on our podcast, but we'll also link our episodes where Karen has had us come on her podcast. So go definitely, absolutely check it out.
You talked about it on the other episode a little bit, but we're getting a lot of questions about what are the different types of assessments and why do you need each type? Like who is what's best? And I found myself explaining it multiple times and wanting to explain it to the clinicians on my team as well so that they could give the best information to the parents.
Yep.
A lot of kids come in with assessments, but a lot of kids do not. And maybe they had an assessment when they were much younger, but where do they go now and what's really needed? And so I thought it would be really great to just have a Karen teaches us all session about what the differences are and like when do you need what and why. And let me just say this, you guys, if you haven't listened to episode 61, I think it was one of the first times where we just sat there and listened. It felt
Karen teaching us. We love those episodes.
I love those episodes. And so if you can just help us understand in a very concrete, easy way to help people who aren't in this field, what do you say? What's the difference? Like, why do you need it? All the questions.
And that is a lot. And I get the question a lot as well. One of the things I often say is that people are seeking an assessment because there's something going on that they do not understand, and they need more information so that they can make decisions about their child's care, about the kinds of support that their child needs. And so when we're talking about a neuropsychological assessment versus an educational assessment or a psychoeducational assessment, one of the things I often say is that both assessments can be incredibly valuable for understanding, for supporting a child, a teen's development, but they're different in terms of their approach. So, if you suspect a child, for example, has some neurodevelopmental, some neurological disorder that might affect the way they think, the way they learn, you might consider a pediatric neuropsychological assessment in that case. And some risk factors. Maybe the child has a low birth weight, had problems with speech and language when they were younger, may have had OT when they were in preschool. So there's some early risk factors for some other cognitive areas of concern. So that's when you might want to consider something more comprehensive like a neuropsychological assessment. But if the primary concern is academic performance or learning in general, then a psychoeducational evaluation might be appropriate. And it can differ depending on the needs of the child. Sometimes parents don't know.
Right.
And they don't know, what is that going to look like?
Like, what are the differences?
Right. And I would say that, a neuropsychological assessment, one is conducted by a neuropsychologist, right? So a clinical psychologist cannot do a neuropsychological assessment unless they've had specialized training in neuropsychology. So you're going to get someone who has a different level of expertise. And what that expertise is that they have a good understanding of the connection between a child's cognitive development, their behavioral functioning, and they're looking at behavior and learning and academic achievement through the lens of a brain behavior relationship. So what does that mean? So if you imagine a child is struggling with reading, for example, or paying attention in school, and you're not sure why, a neuropsychologist will look at the different parts of a child's brain, how those brain parts are working together to help that child learn and behave. So when I'm doing a neuropsych assessment, I will ask a child to solve problems, to solve puzzles. I'll have them remember a list of words. I'll have them tell me a story. I'll read them a story and have them, repeat the story back, answer questions about what they've heard. I'll have them read. I'll have them answer questions about what they've read. All of these activities together as a neuropsychologist help me understand how that child's brain processes information, how that child's brain solves problems, how they remember things. And so it's kind of like figuring out how different pieces of a puzzle fit together to make a whole picture of a child's learning and behavior. Does that make sense? And so as part of that process, I'm going to be able to identify whether a child has a specific learning disorder, whether they have ADHD, whether they're autistic, whether they're experiencing significant anxiety. And my goal is to help parents understand why a child is struggling. That's the question I'm going to answer at the end of that process. Why is your child struggling? Is it ADHD? Is it dyslexia? Is it dyslexia and ADHD? Or is it not an attention issue at all? Your child is just really anxious and has generalized anxiety disorder. Or your child has dyslexia and now they're entering first grade And they have all of these risk factors. If you look at the history, they had a low birth weight and they had articulation issues early on. So now we know they're at risk for dyslexia. They haven't already made that connection between letters and sounds. And so you really need to go and do some early intervention at this stage. So it's all about understanding. It's all about understanding why a child is struggling, because once you understand, then you can provide the appropriate level of support. And that's kind of the lens through which I look at doing an assessment as a clinical neuropsychologist. A school assessment might say, we want to determine whether or not your child qualifies for special education services, qualifies for accommodations or modifications in their school environment, whether that's an independent or a public school. That's the question that they want to answer. And if a school-based assessment is not going to give you a diagnosis, they'll give you a category that makes you eligible for special education services, but you may never understand that other health impairment was ADHD. You may never understand that specific learning disorder in reading is dyslexia, because you won't get that information from a school assessment.
Right. Okay. And then what about a clinical psychologist doing an assessment?
Is that a psychoed?
It can be a psychoed, right? So a psychoeducational assessment is typically performed by a clinical psychologist, although school psychologists can also do those assessments. And again, oftentimes the focus is on a child's academic skills, and again, examining learning processes through that educational performance lens. So how is the way that they learn? How is the way that they remember information in the classroom, access the curriculum? How is that impacting their ability to be successful in their academic setting? And so typically the focus is on those academic skills, the reading, the writing, and math. Those will also be assessed in a neuropsych assessment, but really the focus is on how this impacts them in their educational setting. And for some clinical psychologists, they will expand it. And often you'll also get an evaluation of social emotional functioning. You may not get that in a school-based assessment. I haven't seen many school-based assessments, psychoeducational assessments done through the school district, assess or examine social emotional functioning. But oftentimes a private psychoeducational assessment will include that component. So they'll assess for anxiety, assess for depression, assess for any other kind of mood issues that can impact functioning, again, with the focus being on the academic setting.
Okay.
So scenarios where a school-based assessment is enough, what would those scenarios be?
That would be, for example, a student who is having difficulty in the classroom and they have noticed that the student does better when they have someone reading the work, working with them one-on-one. They do better when they have extended time or when there are modifications to the curriculum. And so you've noticed some of those things, or you notice that they're not able to access the curriculum the way it's being delivered to them. And you want to be able to see, are there things that we can change in the academic environment to better support the student?
Okay.
And so oftentimes a school assessment will be able to answer those questions and make it possible to get those accommodations.
If you have that, what would be the reason that you would then go to a potential psychoed?
Oftentimes it's because you haven't got enough information, right? Or the school assessment showed nothing's wrong. Your child's just fine. He's just fine, and then you hear they're a little behind, but everybody's behind. Everybody went through the pandemic, and so everybody's a little bit behind. Or, I've seen this before. By third grade, they'll be just fine, right?
Yeah.
Or, they'll grow out of it, which is one of the phrases I absolutely can't stand to hear. And so as a parent, if you are seeing struggles, like I often say, the teacher says this is 30 minutes of homework and it's taking you an hour and a half to get through this homework with your child, there's something going on, right? And then if you get a school assessment and the school says he's fine, she's fine, and your child is struggling, that's an opportunity to gather more information. That's when you might seek out a psychoeducational assessment or a neuropsychological assessment to get more information on how to support your child. And I think one of the benefits of doing like a more comprehensive assessment, whether it's psychoeducational or neuropsych assessment, is that you're not only identifying, why your child is struggling, which is a question you want to answer, but with a more comprehensive evaluation, you also get to identify your child's strengths. Because what I often say, and I've probably said to you both, is that it's not enough to know that your child has struggles with reading. You know that, you can see that.
Mm-hmm.
It may provide more information to know that they're not just struggling with reading because, they dislike reading or they've got a language disorder. It's because it's dyslexia.
Mm-hmm.
Now you have more information because we know that there are evidence-based interventions that are specifically designed to address dyslexia.
Mm-hmm.
But if you also know that your child has a strength in a visual memory, or strength in their visual spatial skills, or strength in oral expression, then you now can use those strengths to be able to support them and enhance their learning and compensate for areas of difficulty. If you only assess in their area of weakness because they're struggling with reading, let me just do a dyslexia reading screen, you miss out on the opportunity to identify areas of strength, but you also miss out on the opportunity to determine whether or not there is a co-occurring issue for your child. Because we know that 40 to 50% of kids who have dyslexia also have ADHD. And if you only look for dyslexia and you put them through this intense intervention and you get them the support, but they also have undiagnosed attention issue, you won't get the same outcome as you would if you were treating and addressing both.
Okay, you've now said something. I'm going to pivot a little bit.
Okay.
You've referenced a couple of times risk factors, and I'm actually wondering if this is a separate episode, which we could do with you, where you can sort of walk us through these early risk factors that we know of, let's say, like ADHD, dyslexia, dyscalculia, dysgraphia, and maybe processing issues, something like that.
Right.
Because I don't think I know enough about that early research, which I think could be a meaningful conversation on this podcast.
Yeah.
Yeah.
Because the early risk factors of like the big four.
Some people, it's even more important for them to get the assessment done early because those early risk factors are there.
Got it. But I've never met a parent who did the report and didn't regret not doing it sooner.
I've never met one either.
So one thing that I think you've said that is really important and I want to highlight is the knowing your kid in all of this. So if you have that initial school assessment and nothing comes of it, but you know based off what you're witnessing that there is more. I love that you shared that that's an opportunity to gather more information. It's an opportunity to get curious.
Yes.
At every level of assessment, parents get the results and then they just accept what is, but it's not right with their soul. Mm-hmm. Something's not right. And so we just always want to encourage parents to listen to that part, listen to your parent gut. Steph and I always say, like, we're the experts in educational therapy, but they're the expert on their kid. Mm-hmm. And so listen to that mom gut, listen to that dad gut. If you're a teacher, listen to your teacher gut, right?
Absolutely. I mean, you have a perspective on your child that the teachers will not have. They have their eyes on, 15 kids to 30 kids, depending on the classroom. You have your eye on your one child, right? Or you may have more than one.
Yeah.
But you will be able to see things that the teachers do not see. And like I said, I use the example of homework. The teacher sees the final homework product.
Exactly.
They see the final homework. They don't know that you had to sit there the whole time. They don't know that you had to provide scaffolding. They don't know that you had to ensure that your child was checking their draft for spelling errors, punctuation errors, capitalization. They didn't know.
They didn't know that you were sitting with them.
They didn't see the meltdown, the 30-minute meltdown that took place to even get the task started and completed. And so all of that information is helpful for the parent to know that there's something going on, right? And again, these are things that the teachers don't see. They may not see that it took you 30 minutes to get your child to get out of the car, to get to school, because there was so much anxiety and stress about, showing up that day.
Well, we definitely want to continue this conversation with you on Patreon. If you want to hear the rest of our conversation with Karen, we're going to talk about the client life cycle, the ebbs and flows of our businesses, and sort of what she sees versus what we are seeing. We started this conversation before we even hit record. So I'm like, let's do a Patreon about it. So you can go and listen to that conversation at www.patreon.com/Learn Smarter Podcast. Karen, how can people connect with you?
So they can connect with me by probably going to the website, childnexus.com. That's a great way to get more information. If you're confused about the assessment process still, maybe you want to book a consultation, you can do it right on the website. If you know that you're looking for someone to provide educational therapy or to do an assessment, you can connect with a provider who can do that type of assessment, provide that level of support. Or if you're a parent whose child has just been diagnosed with anxiety, dyslexia, or ADHD, and you want to kind of get some guidance and better understanding how to support your child at home, you can sign up for some of our mini courses. You can do all of that at childnexus.com.
Perfect. And we've linked all that information in the show notes, to this episode. So, Karen, can you say your signature sign off?
Have a great week, Smarties.
Have a great week.
Have a great week.